Hey folks, Dr. McCarthy here, and I just want to shoot a quick video because we had just an amazing result today. And this is not anything unusual here in our office. There's not a week that goes by that we don't hear somebody saying, hey, I went back to see my doctor and they cut my medications. One of the things that we do with folks here is we make massive dietary changes. I actually just got off the phone consulting with a guy that lives up in Illinois. And it's really cool. I was able to, talk with him, and he's hooked up with a great functional neurologist up there. But we talked about food. We talked about food stuff. And so there was a patient here this morning who's like 2 weeks into, Dr. Joe, what's up, bud? 2 weeks into care. She's down like 12 pounds, and her energy level's through the roof. She's just so excited. She's blown away. But then she told me this morning, hey, I got off my metformin. And I'm like, what are you talking about? How do you get off your metformin? She goes, well, I was taking the same dose as I always was, and my blood sugar was going too low. So my doctor said, stop taking it. And this is a doctor, and many doctors say this. Dr. Joe can back this up too. Many doctors say, hey, once you start taking metformin, you can't stop. You can't get off of it. That's just your lot in life until you get so miserable that you're going to have to start taking insulin. And of course, once you start taking insulin, you can never get off of that either. Well, I'm here to tell you that that's 100% false. And we see this on an ongoing basis. If you change what you're putting in your mouth, you can stop taking a ton of the medication that it's most commonly prescribed here, especially in Eastern North Carolina. Man, we take drugs. We love our drugs out here in Eastern North Carolina. But if you actually change what you're putting in your mouth and you take responsibility for your health, you can actually get rid of some of these medications. So we're very careful when we talk with folks about medications. Now, listen, very, very seriously. I don't take anyone off of medication. That's not my job. I'm not licensed to do that. That's not within my scope of practice. I don't want to be responsible for putting people on or taking people off medications. That's dangerous stuff. That's why medical doctors pay, a ton of money for malpractice insurance, and I don't. However, I want to be responsible for getting people healthy again. And as you get healthy, then you can go back to your doctor and get off of the medications. And what's kind of cool is, sometimes the doctors say, well, I don't know what you're doing, but just keep on doing it. And so patients will say, well, let me tell you what I'm doing. And frequently, the doctor will say, it doesn't matter. Just keep doing it. Just stop taking the medicine. I don't know what you're doing. I don't have the time. I don't want to hear about it. But other times, doctors will say, wow, this is really interesting. Tell me what you're doing. So that's the cool part, is when I can in turn educate other medical doctors on alternatives to just taking pills. There's lots of people out there that don't want to take pills. So if you or someone you know and love is taking metformin or is taking insulin and actually wants to, see if you can minimize that, Dr. Joe put up a great post today about insulin. Insulin, we all think of that as a blood sugar issue, but insulin has a lot of impact on your fat levels as well. Insulin will make you store fat. Insulin will destroy nerve connections. Insulin can create peripheral neuropathies. Insulin can create different kinds of cognitive disorders. Insulin's nasty, but you can take control of how much insulin is floating around inside your body by changing what you eat. That's what we do in our office. If you or someone you know and love are taking too many medications and you're ready to minimize or get off of these medications by taking control of your life, you need to give us a call. Thank you for watching. I appreciate your time. Share this information. And if you have any questions, just ask them down below. Thank you. God bless you.